Today, we're diving into the world of dermatology with Dr. James Wang.
The tools that have come about in the last few years technologically have been superior to anything we've seen in the last decade or so. The beautiful thing about the skin is it usually gives you time. There are not many organ systems where you can identify something in the precancer stage easily and address it, right? So the skin gives you time. The end of the acne journey is not the end of the total journey. And then that's when we move into the more aesthetic side where people may not know there's a way to treat it. People say, oh, I didn't think there was anything you could do for acne scars. And we know that could be far from the truth. Trying to skip the step of the medical and going straight to aesthetics without understanding the skin is a mistake because you will make a misdiagnosis. I think facial symmetry is overrated.
Really?
I'm not saying this to be cheesy. I really do believe that the asymmetry is what makes a face beautiful.
Hello, everyone. Paul Fulford here, and welcome back to the podcast. We've had an incredible lineup lately where we've gone from mental performance to physical performance and recovery, and even digital dentistry. Today, we're diving into the world of dermatology with Dr. James Wang, a double board certified dermatologist and dermatopathologist, UCLA and Harvard-trained, that little school in Massachusetts. And we're going to be diving into areas like skin cancers, psoriasis, and eczema, and into the medical aesthetic world with using topicals, injectables, and energy blends for his innovative and approach as it relates to combining all of these things and finding the right way to incorporate that into a patient's life. So without further ado, let's just dive right in. So Dr. Wang, in recent years, there's been a heightened awareness around skin cancers. What are some recent advancements in early detection of skin cancers?
You know, I think the tools that have come about in the last few years technologically have been superior to anything we've seen in the last decade or so. However, I still believe that the most important tool in the tool bag is that people are aware that people can get skin cancers at any age. And so over this time period, you know, certainly since I've been in California, we know that the education level of people on the various types of skin cancers, their prognosis, and when and how often to get skin checks really has impacted truly the advancements that we've made. And so even though we do have things like mole mapping and various technologies that we use to detect moles, but also something called dermoscopy, where you can actually study the intricate details of each mole to just figure out which kind of skin cancer it is. Ultimately, we find that the most helpful resource is still that the patients are aware that they should be getting skin checks on a regular basis. So with all this technology, in the end, it's the people and the human factors that make the biggest difference.
So how regular should people be getting skin checks?
The recommendation for a normal, healthy person is about once a year. Now, there are people who require more frequently. So in those who have a history of skin cancer, and it depends on what kind of skin cancers, but in general, for the most common kinds, non-melanoma skin cancers, we do recommend once every 6 months from your last skin cancer for up to 2 years afterwards. If you have not developed another skin cancer in this time period, then we revert back to once a year. But it is very individual. So some people who prefer to be extra safe still come in every 6 months just to be safe.
What can people do in between those annual skin checks, right, that they can do at home, right? As far as looking in the mirror and what should they be looking for?
Yeah, this is a great question. And I think it's different for everyone because I think doing self skin checks generally sounds like a good idea. I find that it leads to a lot of anxiety in people. Now that we have Google and various other things at our fingertips, I think it's really easy to try to match what you have with something online. And we know that when we do that oftentimes the worst things show up. And so the anxiety associated with that may not actually be really corresponding to the actual risk factor for that particular lesion. So I do tell people the biggest things to look out for are changes that are noticeable in current moles. And certainly if you have a question or you are concerned, go see a dermatologist. That way you can get it checked out versus guessing what it is. A lot of the characteristics people think that they're looking for, the ABCDEs of melanoma, right? The border asymmetry, the color, is it raised? Those things are helpful for certain types of moles, but has to be a mole that you're looking at anyway. So oftentimes what we think are moles are actually not moles. And sometimes what we think are not moles are actually moles. So these things take a lot of time to train, which is why residencies and training programs exist. And it takes a lot of effort and training to differentiate some of these things. There are over 10,000 dermatological diagnoses in the textbooks. And so everything can look the same to the untrained eye, but certainly for those of us who've seen millions of moles, just looking at something, we have a general sense of whether there's something that should come off or stay.
I can tell you, and I can tell the people listening in, that what you have to go through as far as like your board recertifications, I can only imagine how crazy that is. I was talking to another one of your colleagues, Dr. Zena Gabriel, about this right after she had done her boards again. And the amount of information that you all have to retain and learn is insane. And the crazy thing she was explaining about some of these questions that you have to do on those tests is you can talk yourself into like 3 of the answers, right? So what would you say is like your normal assessment process when like doing something from a medical dermatology standpoint, right? Is there a standard process that you follow when trying to start somebody on a journey? And, first with medical dermatology, and then as we'll get further down the road here into the podcast about the medical aesthetic side of things. So is there a general process that you follow? Do you start people with medical dermatology first, or sometimes people are coming in as aesthetic dermatology patients? Do you bring them over to medical dermatology? How do you blend those two in your office?
Yeah, that's a good question. I think medical dermatology and aesthetic dermatology, even though people like to differentiate them, I do think that they are really a continuum on the spectrum, right? And so I think even though we like to kind of separate these things out, when I'm looking at a person or talking to a patient, it's never whether it's medical or aesthetic, right? For me, it's how is your skin health? What does your skin look like? What is the overall background? Who is this person? And all these factors, the socioeconomic factors, the background, the family history, what they give, the things that they concern about, they all blend together. And I think there's no such thing as aesthetic medicine or aesthetic dermatology without really understanding the medical side. Because a lot of the things that cause us to have issues with sunspots, or I don't like the way my complexion is, or pore size, or redness, these things all show that there's something wrong medically with the skin. And so that manifests in these cosmetic ways. And so I think trying to differentiate them, or trying to skip the step of the medical and going straight to aesthetics without understanding the skin is a mistake, because you will make a misdiagnosis.
Talking about the aesthetic side, there's been in especially in more recent years, I think sometimes it's cyclical, but a more of a larger focus on natural looking aesthetics or natural looking enhancements. What can you share as far as some techniques that, including injectables or energy-based devices, that people can do to give them that refreshed look? Like, what would you say the normal thing is that people gravitate towards, again, doing their research, right, on their phones? And, how do you accomplish this more natural looking, believable look that is them, not somebody else?
I used to think that there was natural and unnatural looks, and there are, but I've learned to stop projecting my own true opinions on these things, because the most important part of that whole assessment is the beginning, right? They're coming in for a reason. They're coming in for an evaluation. They want guidance, but in the end, there's a specific look that they're going for. And when they say, I want a natural look, natural means different things to everyone, right? And so what I believe to be a natural look may not be what they want in the natural look. And it's important to tease out, when you say natural look, what does that mean?
Yeah. So when you ask them that, you're like, okay, what does natural mean to you?
Yeah.
Okay.
It's both functional and also, visual, because I have people who come in and say, I want a natural look, but I do not want to move my forehead and my hands. So there are different forms of natural. And I think an unnatural look could be different things. It could be movement. It could be shape, right? It could be the way the skin reflects light. And so some people may want a certain part of it to be unnatural, because that's what they view to be a beautiful trait,
right? And
other things to look more soft, right? And so I think parsing it out, it's never an all or none phenomenon. It's always a matter of like individual features that someone really wants. And so I never tell someone like, oh, you totally shouldn't do that, because ultimately as a provider, there's certain things that I want to make sure that patient is happy with. That's there's certain things that are dangerous or that I feel like I should offer a pro and con to. When you get frozen, these are the things that you'll experience. These are the things that will happen. And I think patients have the right to decide for themselves whether it's something they want to go forward with.
And when they come in and ask for something that you feel is unnecessary or unnatural, you have no problem saying no, right, in your practice. What would you tell a patient that is looking for that, and when they're looking for a doctor, without obviously judging any colleagues, right? I never asked you to do that, but it's, if somebody's willing to do all these things, like what would be some red flags to look out for, so to speak?
Yeah, I think it's not necessarily that we say no to everything. I think it goes back to what I just said, which is we really want to understand someone's total aesthetic, why they want certain things. But I feel my job as a medical professional is to let people know, in my experience, these things look a certain way. These things act a certain way. And so offering the pros and cons allows the patient to decide for themselves. Now, we can technically do a lot of things that can look natural or unnatural. I think things that bother someone may seem trivial to a typical person, but when I give lectures, I always say it's not our position to really judge people, right? And if they're already in the office, they're there because it really concerns them. I want to make sure that we listen to our patients and that we do address those concerns for them. If there's something that we feel like we can't do well or to their satisfaction, then we are honest about that too. And there may be someone who can do the aesthetic for them, but it's something we feel like is kind of outside of our wheelhouse. Because yes, we do want to do a more quote unquote natural look. And that to us means something different than maybe what the patient wants. But we are very clear about that up front.
Acne scars and scarring is something that can really impact someone's self-confidence or self-esteem, right? And I know from working with you for a while now that there's plenty of cases you have where you've been able to treat somebody that was going through some things with a multitude of modalities and protocols, right? Can you share a story, obviously without the patient's name because of PIPA, where that was really something that kind of stuck with you, something that was like super impactful when you were able to help somebody with that and give them that confidence?
Yeah, I think that's where we feel blessed in as a dermatology practice. We have access to all the tools, right? We have access to skincare, natural products. We have estheticians. We have topical medications, oral medications. In our practice, we also do clinical trials. And then we have this other side that is injectables and collagen stimulators and energy-based devices. It's amazing how far you can guide someone through that journey. The typical case is someone comes in, I've tried these products over the counter, nothing is working. Or oftentimes they'll say, I had a bad experience with doctors in the past. All they did was give me antibiotics for 4 years. And I understand that. I think it's one of these changes in medicine where it used to be a very top-down approach to doctors just telling patients what to do. But we've seen in the last 10, 20 years that people want to be involved in the healthcare. And so I actually love that because every patient is different. We have a different treatment plan for every person, depending on the severity of their acne, depending on what they want, the kind of relationship that they want, and what bothers them, right? We're never going to tell someone this is the end goal because everyone has a different end goal. Where people who are just like, I want to break out less just to the point where it doesn't bother me anymore, right? And it's not super obvious. With people who come in with acne that lead to infections or drainage or scars. And we're able to talk about the entire journey from beginning to end. And so we never say, all right, your acne's done. See you later.
Right.
We have lifelong relationships with people. And oftentimes when we get younger patients that come in with their parents, we end up getting the whole family, siblings, even people with adult acne who are like, oh, when I was growing up, we didn't think that there was anything you can do about acne or these particular scars. So our patients, we put on Accutane or we don't use Accutane, other ways to get them clear. They're very grateful. But then we continue the journey on. When acne goes away, There oftentimes are browns and reds and even atrophic scars, indentations, things that can be disfiguring for a lot of people. So the end of the acne journey is not the end of the total journey.
Right.
And then that's when we move into the more aesthetic side where people may not know there's a way to treat it. People say, oh, I didn't think there's anything you could do for acne scars. And we know that could be far from the truth. We have so many tools now that don't even have a lot of downtime.
Right.
That are not very painful. And we get people very far along that track and people are just really happy. So getting people from kind of a hopeless, I'm getting the same thing from everyone, to a really customized plan medically and cosmetically gets people to the end point where their friends and their colleagues and their family are just kind of blown away. And that's an amazing transformation for a young person, really for anyone at any age.
I think, again, and there's so many things that you all do in your practice and that can be done in dermatology, both medical and aesthetic, right? Those acne patients, when you're able to do things for them, it really is life-changing in a lot of ways, right? From what you were saying, your typical approach, and again, I would imagine is most likely the normal approach, is always really try to address if there's active acne and acne first before going into energy-based devices and other things and topicals, or there was always once this school of thought, which I know that you have insight on, where you shouldn't, when and when not to use other treatments with Accutane. Can you go a little bit further into that, like as far as like the blending of the protocol?
Yeah, I think everything that we do is customized. So we don't really have a rule. One of the first things I ask people when they come in is like, what is your goal? You're here, welcome. What are the things that you were looking for? And again, I don't like to assume things. And so if someone's like, I'm getting married in 4 months, that is a very different treatment plan than someone who's like, I just want things to improve over time. I've had this for 20 years. And the reason it's different is because we have all these tools, how we combine them, how aggressive we go, the timeline, the ability to take downtime, all these things change. And if we know how to use all of these medications or energy-based devices or injectables really well, then there should be no set plan that's the same for everyone.
Right.
We think that the results we get are so great, and the reason for that is because we are able to combine things based off of what our experience is, but also what the patient knows. We never kind of give up on people, right? So someone's like 4 months, we're like, great, challenge accepted. We can treat acne now at the same time as we treat acne scars. There's no rule that says you can't do that. And we know how to do it safely. And there are actually energy-based devices that can also treat acne, active acne, as well as acne scars at the same time. So the old dogma of you can't treat active acne with lasers is not true anymore. We have a lot of technologies like our the lasers that we treat redness with that can also decrease inflammation and active acne as well. So I tend to shy away from, textbook, and even though, all those textbooks that we've read, 20,000, 30,000 pages of it, they tell you what an ideal situation looks like in a vacuum. But the beauty of experience is that it allows you to dissect apart, when are those ideal prototypes true? And in the real world, what are we seeing? And if you can't adjust to your experience that you have, then you never get better as a provider. No, none of our patients expect us to be perfect, but they expect us to listen to them, understand the journey, and work with them to achieve their goals in the way that they want.
Right. And so the schooling is gaining the knowledge, but wisdom is practical application of that knowledge.
Absolutely.
Right.
Absolutely.
And a lot of your business comes word of mouth, right? And it's, other means, but a lot of it's word of mouth. And basically what people should be searching out is someone's experience with things, right? That's what can set somebody apart from good to great as far as their approach, right? Like you have multiple tools, and in your practice, you also have some tools that looking from the outside may seem redundant, but some respond better to others, right? And it's about having the most tools in your toolkit, whether that's your knowledge base or devices, modalities, topicals, injectables, to be able to treat that patient, like you said.
Yeah, and I think experience also means different things to different people. I think just because you've been in practice for a long time does not make you a better provider, right? It's the ability to adapt and learn and learn from your mistakes and acknowledge them. That allows you to improve. And I think there are some excellent younger providers who are in the mindset of learning with their patients as they see more cases. But you have people who, I think they feel like they know everything. And if that's the case, then you never get better as a provider. And I think patients can these days really sense that. They don't want someone who, is in it for themselves. I think they want someone who really wants to help them. And if you can't listen, then that you never get to achieve that end goal.
Well, and experience doesn't always mean years, right?
That's right.
It's
a mindset,
right? And it's somebody who wants to do more, right? Like one of the things that you help with. I've had the luxury and the pleasure of being able to speak with you at different occasions where we've had different events we've been at. You have a passion for educating other providers, right? And that's not something that you just can get up and do. That's from experience, right? It's not just like, oh, here's some material, present it, right? When you're presenting, and especially the way that you present, you want to make sure that you're inserting your own cases, your own before and afters, right? What would you tell somebody that is not necessarily, let's say, somebody that is a medical dermatologist, right? We'll have a wide variety of people that are listening in here. Let's say it's a colleague or a peer that is a newer provider that's a medical dermatologist that hasn't had a lot of experience with the medical aesthetic side of things. What would you suggest to them as a good thing to do in order to learn about what they want to bring into their office?
I experienced this firsthand myself because, I started off as a medical dermatologist, and it wasn't that long ago that I really started to delve into the aesthetic side because it's actually what our patients wanted and needed. And I think one of the things from trainings is that it can actually turn you off to the aesthetics industry because while you're training, you're focused on very specific packets of information and you're focused on taking tests, right? Your whole life, your whole training, decades of just, I learn information to take a test. I learn information to pass this. But once you're out in the real world, tests are different, right? The tests are your results. And the tests are patient satisfaction, and the tests are the relationships we build with other people. And I think having an open mind really makes a difference because I think there is this misconception that somehow if you interact with beauty industry or pharmaceuticals, somehow you've sold out or you've been corrupted in some way. But I think it's super important in all facets of this is really to have interacted with all facets of this industry, right? When we're treating patients, it's not a silo. Patients expect you to know not just the medical facts, but the names of medications, the new procedures that are coming out, the information, how people are using various technologies. And if you don't know that information because you've been resistant to interacting because I'm holier than thou type of mindset, then you actually have limiting yourself to just one corner of what you can offer patients. And so we always give patients all the options and we categorize them for them, right? In the beginning, it's like, this is the natural, holistic side. These are the pharmaceutical side. These are the energy-based devices or aesthetic side. And people get to really understand how things interact with each other, and understanding that interaction is such a wonderful and fulfilling thing because you get to see not just the pros and cons, but all the nuances of how they fit together to create better results. I think we like to simplify things because it's easy to understand. It's this or that. It's binary. Everything's binary, but we know that's not the case.
There's 256 shades of gray, right?
Correct. Yeah, that's right. Right. So that's right.
Do you find, or did you naturally, were you blinders open, or did you start with blinders pretty narrow? Like, was there a time, was that your natural way of being, or did something happen where maybe you were once this way and you opened them up a little bit?
I had the blinders on. I think when I first came out, I was a very, I will only do skin cancers and basic acne and stuff. And I think there's such joy in doing that by itself that you can spend your whole life dedicated to doing that. And I think there are a lot of amazing academic dermatologists who have really advanced the field in that way. I think my opening my blinders was kind of accidental. I opened my first practice in LA in 2019, and I think I realized that my patients, even though they respected the fact that we, cleared the acne and helped with various things, they really had lots of questions about all the things that they're experiencing online. And so I got my first few lasers there, and then got pulled on stage once and got suckered into the whole thing. But I think one thing we've talked about this before is really putting yourself in that position forces you to learn more. Because if I'm on stage talking about something, I better do my research. I want to know every detail of every slide I'm presenting, and then putting in my own experience, right? People, when you hear a talk, what makes a good talk and a talk that's just mediocre? I think talking points are fine. People are like, oh, okay, that's helpful. But what people really want are the stories, the personal anecdotes, the little pearls that we throw in. And that can't come from bullet points. It really needs to come from experience.
And it can't come from the sidelines, right?
That's right. That's right. And it can't be just a dead information. It needs to be alive in some way. And the only way it can be alive is if you've had experience, you can talk about some of the nuances of what you're presenting. And I think that has allowed me to be like, hey, I actually don't know that as well as I should. And every talk I go to, I speak with so many different providers across the country and internationally, and I learn something every time. It's amazing how differently people use the information that they have and the tools that they have. And I don't think there's a limit to how good someone can be if they're constantly learning about these devices.
That's one of my favorite things about speaking with you all at these events and these workshops and attending them is that everyone is such great providers in their own right and run different kinds of practices and different specialties. But there hasn't been a single time over years and years where there's not something I learn new or something that is like an aha moment for somebody that explained it to me a way that just actually sinks home, right? Do you find yourself finding more and more, especially as you've become more patient focused, right? Like with your varying approach, do you find that it's helpful or you are looking for more analogies to explain things to people that are maybe outside of what they're dealing with, real world examples to explain things to them? Is that something you find helpful? And like, what's maybe putting you on the spot? What's a good one that you use that helps somebody understand something that is maybe a little complex, but you give them an analogy and it makes sense?
Yeah, I'm less of an analogy person. I realize this. I'm always impressed with people who can come up with analogies like that. I think one of the examples like someone comes in and said, "What should I do?" I don't know. And because I like to educate, I like to talk about the layers of the skin, right? Layers of the face, actually. So bone, you have your muscles, you have your ligaments, you have your fat, and you have your skin, and you have the surface. And so explaining in that way and how what we do addresses each of those layers, it puts things in an organized way, not just for the patient, but also in my head as well. Because I think without knowing that, people think, oh, we're just doing a bunch of random things there. But there's actually a method to it, right? And I think the method takes time. But as people start to understand this more and more, and they understand facial anatomy, then they understand the value of what we're doing. At this point, we've built an incredible set of clinics in Southern California and Northern California now, where my job becomes less creating analogies or telling other people how to explain things. I think what I've noticed is we have 14 doctors and dermatology specialists that work with me, and what we're trying to do is figure out how each individual provider has their own style of explaining things. I think taking someone else's analogy or language and incorporating to your own language, if you do it in a stiff way, there's no connection. And I think every provider, providers are human beings, and we all have our different ways of how we tell stories, how we like to organize information. And so helping guide young minds, I like to think I'm young, but when I say this, it makes me sound older. But when I'm guiding it, it's a lot of it's like, how do we bring that energy and their own intelligence and their own emotional EQ type of stuff out to make that consultation the most effective it can be.
So do you find sometimes you're switching providers to patients a lot of times based on personality or who you feel like might be more receptive to that person to help that patient feel more comfortable with what they're doing?
I think the beauty of kind of what we built at Metropolis is that you can go to any of our providers and get that connection. Everyone does it differently, but in the end, I think our patients really feel connected, right? So getting that information across in a way that is non-threatening, non-judgmental, but always with their best interest in heart, and knowing that we have very advanced tools to do the job, I think is something that our patients love. And honestly, even when I'm not there at a certain time, my patients are more than happy to see the other providers in the clinic because they know that what we have is unique, is that everyone in the clinic has a certain caliber, certain personality, and that we will treat people to the best of ability. So there's not like, oh, I'm seeing someone else, I don't want to see anyone else. Our patients know that wherever they come and see, they're going to get high quality care.
So part of your brand identity is that if they're here, they meet a certain standard, basically, and you're going to be in good hands. That's what everyone strives for.
Yes, and we still strive. But look, we're not perfect. We certainly, it's easier said than done. And I think these are hard things to accomplish, and I think our patients know that. But I think they know we're doing our best, and everyone has a good time. We are really friendly, and we are open, and I think that's all we can.
And it's why you've been able to, in less than 5 years, grow to 5 practices. You mentioned in 2019 you started, and now you've been able to grow this, effectively.
Yeah. We haven't done any ads or anything like that. For us, it's truly a word of mouth. We see entire families now, entire workplaces. I think people really respond to what I hope is really the new wave of dermatology, which is patient-centered. And I don't like to say this in a cheesy way where it's just like a lip service to this. I really do think building a business around patients and all aspects of their care, from the vibe to the way people check in and the way people are seen and the way people are followed up on and get into CS and availability. These are all part of what we try to do for our patients.
So you mentioned earlier, when you had the blinders on, skin cancers, right? And that's something you specialize in. What are some things that people can look out for, are also typically ignored, that are like early warning signs for something like melanoma?
Yeah, I think the tricky thing about melanoma is that it can look like anything, and that's for those of you who are hypochondriacs out there, that probably did not help your thought process. But I do think that skin cancers are really variable, and I think the language is also important because there are different types of skin cancers, and they aren't necessarily all dangerous. So I think when people hear the word cancer, they get very scared, and they're like, "Oh my gosh, how long do I have to live?" And I think with skin,
it's not funny.
Yeah, but it does. We see this this anxiety associated because, again, people are Googling things and you're hearing these terrible stories. I think the beautiful thing about the skin is it usually gives you time. There are not many organ systems where you can identify something in the pre-cancer stage easily and address it, right? So the skin gives you time. So there are things that you just should not ignore. If something just feels wrong, instead of trying to guess what it is and Google it, go in and see someone and at least have it checked out. Like I tell people, yes, parking can be annoying. You may have spent 3 hours there. You may have waited 20 minutes. Having a peace of mind is worth all of that, right? Be like, oh, that's actually not even a mole. That's a seborrheic keratosis. Like, oh, great, I feel a lot better, right? And even with skin cancers, even the most common ones, they're not dangerous. Meaning they can grow locally, but they tend not to spread. And so you have time to diagnose it. You have time to remove it. You have different options for removing it. And having someone who can talk about all those things in a way that doesn't increase someone's anxiety, I think is really, really helpful. Certainly, we do catch skin cancers that are serious, right? And I think those times should be far and few in between if you're getting regular checkups with your dermatologist. We catch things early stage. If we caught something really late stage, that is a failure on our end. We want to make sure that when we are concerned about something or the patient's concerned about something, we're not going to be like, we can't take it off for you because, we are humbled because as a dermatopathologist, when I trained in New York, we caught things all the time that the clinician thought was normal. and you take, oh, the patient wanted this off, they removed it, came back. Ooh, glad we took that off. I think, sure, all the years of training are helpful, but there's nothing that's 100% in healthcare. And I believe that if patient's concerned or we have an inkling concern, that's something that we do need to take seriously and move forward with the right steps.
Other skin conditions like, psoriasis and eczema are often dismissed off as minor issues. Like, what can somebody do, or what advancements have been made, and how would you approach that, especially when it becomes severe, and it's something that persists?
Yeah. So we see a lot of atopic dermatitis or eczema and psoriasis. Actually, we have clinical trials on these particular topics really at all times. These are very important fields of medicine that require advancement. And in the last, 5 to 10 years, we've gone from giving everyone steroids all the time to now having so many non-steroid options, both topically and injectably, and now with pills. And so that has come such a long way from when I was still training in residency till now. It's unbelievable. And at this point, I can almost tell someone who have these conditions, if we march down this path, know that we will be able to clear your condition. I know it's frustrating, and you may only have been given topical steroids your whole life, but if we walk down this path and we're willing to talk about the risks and benefits of some of these medications, it can be life-changing. There are things that you can do once every 3 months, and you will not have a single psoriasis spot forever or for years at a time at least.
That's another one of those that's like acne scars, where it's so self-confidence draining and for some people, right? They're afraid to wear bathing suits, right? And it bothers them mentally as much as it does physically, right? Now, and with advancements in that, is there cases where that medical dermatology blends in with the aesthetic? Like, if there is brown spots and such left behind, are you able to go after that with any devices to even further clear that for them?
Yeah, I mean, it goes in both directions, right? So psoriasis can be seen as an aesthetic thing because you're like, oh, someone has big plaques, they're self-conscious, but psoriasis is an autoimmune systemic condition, actually, and people get psoriatic arthritis, people get issues with vision, people get issues with other things. So it goes in both directions, right? So aesthetic always has a medical component, and medical components like psoriasis also has the cosmetic component to it. I think certainly as we treat these conditions and the dermatitis goes away, you're right, people are left with sometimes semi-disfiguring areas of pigmentation or changes in skin laxity and other things. And absolutely, we have tons of tools now, and they can really range in things that are not very aggressive to kind of more aggressive. Again, having that range allows people to select what's appropriate for them at that moment, right? And so we have many devices, and the reason we have many devices is because I like to invest in machines that do that one thing in the best way possible, right? I like to make sure that when we're treating rosacea or psoriasis or eczema, whatever it is, that we have the best device to treat that. There's a reason these devices exist, and people try to separate out devices because I think sometimes there's these devices that say, oh, do everything, but not very well. And so after having done a lot of research on this and been in the field for quite a while now, I'm familiar with some of the things that have had great success in the one or two things that I think make a difference for patients.
Again, I think for people listening in that are patients, right, one of the things that you can make sense of, I know sometimes people get freaked out when they listen to all the side effects that on the drug commercials on television, but there's a reason why there is a drug or drugs that treat arthritis as well as psoriasis, right? Because those conditions are linked. And I think that's in many cases, right? So I think that's something that the consumer at home doesn't understand. Why would this be treating this and this? But there's a tie there, right? And that's something that a lot of people don't realize.
It's not just the information, because anyone can find information these days, but it's how do we tier and organize that information? And so when side effects are put as all equal and there's 100 of them, of course, no one's going to do that, right? But knowing the frequency of these things, how often we see it via experience, is really helpful putting things in context. Everything has side effects. Everything has risk. All natural things have side effects. All natural things have risks. And so whether it's synthetic or pharmaceutical or lasers or your skincare, everything comes with its pros and cons. Life is full of trade-offs. There's almost nothing without a trade-off. And so things that seem too good to be true generally are, and things that don't seem like they have side effects, there maybe you just are not aware of what the side effect is so you don't know what to look for.
I would say you're an expert with injectables, right? And how you go about your approach with those things. What's your approach to addressing like facial symmetry, and how do you explain that to a patient with what they're saying they want natural, and then what you're going to be able to do with just the injectables and neuromodulators alone?
Yeah, I think facial symmetry is overrated.
Really?
Maybe a little controversial, but there recently, and I think many of you may have seen this, when they reflect celebrity faces and they make them perfectly symmetrical, the result is actually a less attractive person. And this comes from the fact that we're all unique. And again, I'm not saying this to be cheesy. I really do believe that the asymmetry is what makes a face beautiful. Now, there are certain ratios and proportions that generally have been standardized to be like, oh, these are kind of beautiful proportions. And certainly people can work towards that. But trying to achieve perfect symmetry is really not the goal, right? We really want a face that moves naturally with a patient's own anatomy, meaning when they're smiling, there's certain areas you want to move to show really more of a balanced set of movements. I think what people oftentimes focus on are individual areas versus on the holistic part of the face, right? So it's really how everything works together. A specific eye shape on someone may look great, but not on another type of face. And so these are kind of things we have to figure out what works together in the context of the size of the features, what things are maybe a little bit smaller than typical or larger than typical, and you can kind of adjust that for people. And this is why for us, when we do injectables like filler and toxin, we actually space it out over time. So we see people back once a month and we make adjustments. We let things settle in and we do that over time. That leads to a gradual change, and we don't want people to have this like shift in the mentality. We're not here to make transformations. I think plastic surgery maybe, but as a dermatology office where our patients are young, they want prejuvenation. They don't want their friends to know necessarily. It's a stepwise approach. It's methodical, it's thoughtful, it's deliberate, it's never random, and we're never there to sell 1,000 syringes in that same visit because it doesn't give a good cosmetic look. And we're here to make long-term relationships with our patients. And people really appreciate the step-by-step approach and the cautious approach to injectables because there are risk factors to these things too.
Two things came up when you were talking in my head. One was you were talking about those celebrities side by side. I read somewhere at some point that Denzel Washington does have a very symmetrical face when you do that side by side. And then the other thing, because I constantly hear how amazing he is in my home for my wife, is that she says that Harry Styles has the perfect golden ratio of attributes on his face. What you said is dead on, because people think that's what they want, right? But when you explain it that way, where it's like, look, you're doing this here because you're trying to help the whole structure. Are there advancements that you utilize or that are available for people that to actually sort of authentically be able to see something before they do it? Are there any tools available for people to kind of give, like, hey, after you do this, you could potentially look like this?
Oh, yeah. I mean, there's a lot of three-dimensional reconstructions of what it can look like. I think a lot of plastic surgeons have this. It's really hard to imagine what something looks like before you do it. And so they have software that allows you to do that. I'm sure with AI these days, it's going to be extremely accurate and also really giving you a creepy level of accuracy and reality of what you can look like. And I don't necessarily think it's a bad thing, but I do think it does warp perceptions of what beauty is and what people can achieve. So I do want to caution that beauty is an evolving process. I think standards also evolve, but ultimately the patient in front of us guide our work. We don't have like a set face we're trying to achieve in our practice.
You've used a lot of different tools in the practice, right? We're going to get to maybe some specific ones now. What advancements have been made in with your experience on different tools to go after vessels or brown spots. And you mentioned that you've looked at or utilized and you've found the right tools to do things for you.
Yeah.
What are some of the differences between these tools, and what are some of the ones that you use regular on a daily basis to address a variety of skin conditions specific to reds and browns?
I think the tools that we have, there's a theme or pattern to it. A lot of our devices come from specific companies. Like we have a lot of Cynosure electronic devices, and that is not random. Being in the space long enough, there are patterns to companies that copy and the companies that innovate. And innovation is one of the most powerful sources of excitement to me, because I feel that with the innovation comes that ability to learn and adapt and take feedback from customers and make things better. A lot of the devices, were built and designed for skin of color. And I think that is so important, because as the world converges on kind of like medium type skin, we have to make sure that the lasers and the energy-based devices that we have can treat them safely, right? Not as an afterthought. And so I really like devices that were built for all skin types. I like the innovation. I like things that actually move things forward, not just iterations of the same thing. And so the devices that we use to treat reds, we can start with reds first. Probably my favorite one is a device called DermaV. DermaV has come out just a few years ago, and it's really changed the way we treat vascular devices. I think if people knew what this device could actually do, I think everyone would want to have one, because it really is a huge step forward from what we currently have. Prior, people think of lasers as, oh, I'm going to be bruised, or I'm going to have downtime for X number of time. I have a high risk of being burned. It doesn't treat this and it doesn't treat that. But this is a device that has really consolidated some new technologies where we can safely treat skin of color without a lot of downtime, without bruising, and its effect can take place within 1 or 2 sessions. It really has changed the way we talk about these things, because we can't guarantee, but we can almost guarantee that people are going to be happy with the results. And I think that says a lot about this. It makes our job easier, it makes patients happier, and I think people get a lot more value, because when people come and see us, we know we're not the cheapest place to be seen, but people pay for the services we do because people see value in knowledge and investment in good technology. And those two things paired together is powerful and worth it, in my opinion. For browns, we actually have lots of options. And I think browns are complicated because there are 20 million types of browns. And the brown could be on the surface. It could be deep in the skin. It could be caused by inflammation from before. It could be caused by sun or hormones. So when I say we customize things, I really mean that. We have 4 different lasers that we use for different types of pigmentation, depending on where the pigmentation sits. So that consultation is so important, because it allows us to identify those things and then come up with a treatment plan, to make it better. And not every treatment will resolve the issue completely. There are conditions that are going to be lifelong, and there are certain lasers we use to maintain people over time, and it doesn't always work. When we talk about skin conditions, there's so much we don't know about the skin and why things come back or evolve, that it's really going to be a relationship-based treatment routine. I think this is something that our patients understand, is that, look, 90% of the time we're going to be able to treat this, and 10% of the time we have to really think outside the box. We have the tools. We just have to figure out how to combine them. If something's not working, we don't just do the same thing over and over again. We really think hard about, hey, anatomically and technologically, this should work. Sure, not a lot of people get it done, but that is the power of like a thinking mind and innovative technologies.
And again, while we mentioned earlier, you have that maybe where there's some overlap with some of your devices, because you do need another tool to go after it sometimes, right? 2 things for that as well is, one, I don't think people realize a lot of times, whether it's the patient at home that's looking at something that looks clinical, like a histology of something, or even peers, right, of yours that are looking at histology. The histology done is actually on Korean skin most of the time, right? Because the international headquarters where things are manufactured is in South Korea, right? So it's what the patient at home doesn't always know, and what sometimes is overlooked in the medical community is that's porcine skin or pig skin. A lot of times that it's showing, the results on, which is closely mimics human skin, but it's not exactly human skin, right? And then two, you and I have a shared experience because one of those tools, that tool that you mentioned, DermaV, and will show a picture of my own before and after that you treated, where it was basically a really cool case because I had hemosiderin staining on my calf, right, which was caused as a byproduct of venous reflux in my legs, and that's how I actually uncovered that I had it, right? And you were able to treat that, and I mean, it's not. Let's not say it's the case for everybody, but in one treatment, we pretty much cleared it. Which, if people aren't familiar with what hemosiderin staining is, it's a vascular lesion that eventually basically oxidizes. So it starts as red and then it becomes brown. So that's another kind of a tricky one to go after. But I mean, I was pleasantly surprised with, I believe in the device wholeheartedly, right? But I was pleasantly surprised with the results, right? I mean, that was a fun little thing that we did.
Look, everyone likes to be pleasantly surprised. I think no one wants to be unpleasantly surprised. So
No.
I think we get more pleasantly surprised than anything else, and we see the kind of the joy because I said we're pretty conservative in the way that we counsel our patients. So we want to make sure that really people understand what they're getting themselves into, but certainly we get a lot of really great feedback and people are like, wow, this is even better than I expected because we care. And I think because we know what we're doing, we get that more often than not.
And you've said a couple times in, kind of in quotations to not sound cheesy, right? But the care part is the biggest difference. And it's not cheesy. It's when I see the difference between average and good providers to great providers, that care is actually that second, third, fourth, fifth level question that gets asked in that consultation, right? It's not, it's blinders off. It's not Band-Aid. It's like, let's get to the root cause, right? Yeah. So when you have a patient that, laser treatments, and if they start doing that research can feel intimidating, what is it that you tell them when you're explaining these things that helps put them at ease, so to speak, when you're explaining it, and what they can expect recovery-wise?
I think patients can pick up on an individual's vibe, and I think everyone projects a different kind of energy, right? We know this, and some people walk in a room and people get anxious or they clam up,
and they've never done anything to you. They're just sending it out, kind of, right?
And this is what I say. Like, there's a component to this that is very personality dependent, and some people have a gift. And that gift is communication, right? And I think what makes a great provider versus an okay provider, a great provider really has three major components. I think one is going to be intelligence. I think certainly intelligence is going to be a key part of this. I think the other one is going to be the emotional intelligence of understanding, hey, is this really what this person wants, right? And the third one is communication education. Like, how does one take the information, the facts that you stored, combine with the emotional intelligence and communicate in the way where it reaches the person and there's an understanding. Because I think patients are nervous seeing the doctor. They're already kind of clammed up. Some people have a lot of bad experiences with doctors in the past, so they're already naturally suspicious. They have their schema of what a doctor should be, right? Like, really serious, not going to take me seriously, running late, and just telling me what to do, and they don't care. And I think yes, there are plenty of cases of that in the real world where that happens. But having the ability to relax people through energy is key, and the key really is education. I think when people are interested in learning about themselves, I think that's when people relax, right? And that's without judgment, right? And I think because people have a limited amount of time in a medical interaction, people feel that the education is there with a goal or purpose. I'm getting educated so the doctor can leave the room. I'm getting educated so they can sell me this thing. But I think if people feel that they're getting educated because someone cares about them and want them to make that good decision, I think that's just really relaxing to people. I rarely run into issues. People are always like, oh, thank you for making that super comfortable. We do a lot of procedures in the clinic. There are needles, there are blades, there are tons of things that we do that are scary for people.
And sometimes they're just laid out.
Yep, they're laid out on the tray. You're staring at it the whole time, and you're thinking about all those horror movies you saw growing up. But there are ways to walk people through this in a way that is gentle, and I think people can feel it.
Yeah, and you talked about people being comfortable in seeing any provider. They kind of have a standard of care that they can understand. Being a customer in Metropolis, right? Is there a way that you have your process where you're able to, again, not with the analogies, but take some of these complex things and break them down, right? Do you find that it's easier to break things into more bite-sized chunks, or not that the patients are unintelligent, but finding simpler ways to maybe fifth grade level explain some of these complex things? Because do you find that helps with that anxiety, or those things that they come in with?
I have young kids, and one thing I don't do is talk to them at their level. I give people credit for what they understand. I think simplifying things in a way that is understandable doesn't mean you're dumbing it down.
Right.
I do think there's a difference, and I think our patients are extremely intelligent, and my job is to organize the information in a certain way that's understandable to anyone, from a second grader all the way up to someone with a PhD, right? I think even when I'm on stage, I'm giving a talk, I hope that everyone in the audience, no matter how much experience they have in dermatology or aesthetics, they get something out of it. And that's the feedback I'm getting, is that everyone gets something out of those talks. And I think that is a skill set I learned from seeing patients, because we can't assume what a patient would understand from external appearances. I think people like to classify people into certain categories. Like, oh, this person, I'm going to just dumb it down because I think they're not going to understand. But we really have to, our job is to make sure that all the information still gets conveyed in a way that is organized. If it's disorganized, no one can understand it, no matter how simple the concepts are, right? But you can actually explain extremely complex concepts to people who have never heard anything about this before. If it's organized and you've thought about, simplicity is truly the difficult part, right? Fewer words, simple concepts is much harder to get to than verbose speeches. And that is true, because you have to have a full understanding of something to be able to explain it in a way that is clear and concise.
And it's to your point of it's not bringing it down to that level, it's being able to have some emotional intelligence and read the room, right? If they're not receiving it, you're able to maybe I need to say it a little bit differently. Right?
It's also a matter of, if you think about things you've heard in the past, will you remember something that's complex or something that's simple? If you can take just one or two learnings from an encounter with your doctor, that is already more than what most people get. People leave and they're like, what happened again? This is why people have to rely on these sheets. Oh, this is the summary sheet, because they literally could not understand things in the room, or they did, but it's so forgettable that nothing has internalized, right? You really want people to internalize things that they hear. So there is an emotional quality to assimilating information.
So we talked about you growing to 5 practices, right? You also staffed a clinic in Botswana for infectious diseases and complex skin conditions. So two-parter, right? Yeah. What was that experience like, and what did that contribute to or help you see in global dermatological conditions?
Yeah, so that program was actually, I was really thrilled to be part of this program. So the American Academy of Dermatology has a program for senior residents. You apply to this program, and they have a base in Gaborone in Botswana, which is the capital there. They have a basic hospital in the capital, and then little clinics throughout the country. That was the only way for people to get dermatology care. We brought a lot of supplies from the U.S. to there to help with it. What's interesting was that you can see that the respect people had for doctors, that's something that's kind of a universal thing. And they'll be like, anything you say, right? Anything you say. And it was so sweet. And it was really easy to help them because there was this like open communication that they're like, yes, we're absolutely like willing to do this, able to do this. And people know that there aren't a lot of resources and they're very appreciative. I think one of the interesting thing was that initially frustrating was that we did not have the supplies. We're out of liquid nitrogen, which sometimes is one of the few ways we have to treat things like warts and various medical conditions. But it is how to improvise, find other creative solutions to help people. And I think that is one of the keys, like, okay, you're not going to be able to have everything all the time, right? That's life. What are the things you can still do to achieve your goals? And I think that was really what it taught me. We went to little villages. We would take a bus for like 4 hours to get to village number 1. We do a makeshift setup. We would see 100 patients in like 4 hours. And
so you get really good at certain things.
You get really good at certain things, but you also don't have a lot of time, right? But it's really like, then how do you condense the important information and so patient understand what's happening? Again, the information is really that the key piece of it. The treatment itself, absolutely, but a lot of it's just people being like, oh, good thing it wasn't that, right? And so that peace of mind, that communication really makes a big difference in people's lives. And it was a wonderful experience.
So again, back to your approach to explaining things and connecting with the patient, right? Like not somebody that was living in that culture, but still able to connect with those patients and help them, right? I mean, that's one of those things that it seems obviously universal in your whole way of care, right? Yes. You talked about there's always some kind of trial that you're doing in your background, in academia. What have been some key takeaways from some of those trials that you've done, and how do you implement that into your approach for overall skin health now?
Yeah, I think clinical trials are extremely important. And instead, I love innovation. I think, my background is part medical, part business. And so I really, really understand the value of moving things forward. And we have amazing technologies, we have amazing medications currently, but we can't move forward if we're not methodically trying to step forward. And this is actually the initial impetus for why we brought trials into our clinics. We did it selfishly in the sense that we want our patients to have access to as much as possible, right? So what's already available and what are the things that are coming next? And so, yes, you will have some very complex medical conditions that will have failed the current therapies that we have, everything that we've tried. Having this extra thing allows our patients to know that, hey, we care. And even though clinical trials are very difficult to run, requires a lot of resources, a lot of thinking, a lot of paperwork, a lot of paperwork, a lot of red tape. But we do it because we feel like our patients really value that part of who we are. And that's a core value of us, is that we don't do things because it's easy or convenient. We do it because it's the right thing to do. And we can help move things forward on a larger scale.
So what was something that you did a trial for that is something that you now have as part of the process in the office?
So we've done a lot of trials for, psoriasis and eczema, things like that. We've done some for rosacea, and we've seen some of these drugs actually get full FDA approval and come to fruition that we use all the time now. So it's really a gratifying thing to see that, hey, like the work we put in, our patients who actually benefited so much from using this even before it was fully approved is now available to everyone. And it's not possible without the recruitment process and making sure these are safe and effective.
I could keep talking like we normally do for hours about this stuff. Where can the people find you, right? So anybody that is looking for a dermatologist in the greater LA area or coming into town that wants that place that has that vibe that you were talking about, where can people find you on social media, and where can people find you at your website online?
Yeah, so we have 5 locations. We have 3 in the LA area, one in Brentwood near UCLA. We have one in downtown LA, which is the original one. We have one in Pasadena. And then we recently opened our first location in Orange County, in Costa Mesa near Newport. And then we have one in the Bay Area, in San Jose. So those are 5 locations. We have many wonderful providers and dermatologists and dermatology specialists with us. And so you'll be in good hands if you find us. We have our website's metropolisdermatology.com. Just type in Metropolis Dermatology and you'll find us. We have our locations on there. You can kind of read a little bit about us. We have little bios. But just put a plug for everyone else. And our team is intentionally assembled because of our philosophy on the types of people we want to work with our patients. So all our providers are fantastic. All our staff are fantastic. We're here to take care of you. And we think you'll feel that from the moment you walk through the door.
I can tell you that that's somebody who's had the pleasure of working with him and experienced that level of care in results with my own treatments. You definitely will experience that. And I just want to thank you, my friend, for joining us today.
Happy to be here.
Thank you for tuning into the podcast. Obviously, with Dr. Wang's extensive experience in medical dermatology and medical aesthetics, he's able to shed a light on a lot of different topics, from early detection of skin cancers to how to treat pigment vascularity or reds and browns with a multitude of different modalities. And I think when you look at what he spoke about today, whether you're in this area or just anywhere in general looking for the right kind of provider, I think there were some key things that he mentioned on what to look for. And experience is not just age. It is what you're willing to do for your patient. That's all we have for today. Make sure to like and subscribe and follow us wherever you get your podcasts. Have a great day.